Welcome back, everybody, to the RangeMaster YouTube videos, where we talk to interesting physical therapists, occupational therapists, and patients about their businesses, about their recovery. And today, we find ourselves with Kara, and how do you say your last name, Kara?
Welke.
Welke, coming to us from Grand Forks, North Dakota. And Kara has an interesting story to tell us. She has a group called the Next Level Occupational Therapy group. And I'm going to give you a few leading questions, and then we'll get into our conversation. So you're an OT. How long have you been an OT?
So I've been an occupational therapist for 21 years.
21 years. And tell me about, everybody wants to know, where'd you go to school?
So I went to the University of South Dakota, USD Coyotes, go Yotes. And that's in Vermilion, South Dakota. So the very southern part of South Dakota.
Okay. That sounds like an intentional choice. Did you decide early you wanted to be an OT?
No, actually I didn't. I originally went to the South Dakota State University, which USD and SDSU are the big rivals in the state. And I had no idea what occupational therapy was when I went to college. And when I was there for my first year of college, my mom actually sent me a message and said, "Have you heard of OT? You should go check it out." So I ended up going and doing some volunteer observation hours and decided that's what I want to do. So I ended up transferring the next year down to USD, and I got my bachelor's. So for my college, we had to get a bachelor's degree first before we applied for a master's degree. So I went there because I could get a bachelor's in social work. I thought that was a good fitting or a good, degree for OT, just in case I didn't get into OT school. And then I graduated with my BSW and then went right on to get my master's. And then a few years ago, I went back through an online program at the University of South Dakota and got my doctorate degree.
Wow. So was the master's a 1 year or a 2 year program?
It's a 2.5 year program.
Gosh, you've spent a lot of time in school.
I know, gosh, no more.
So do you use the title doctor at all?
I don't. I mean, some people utilize it. Well, I do have one client that calls me Dr. O. He nicknamed me Dr. O for Dr. Occupational Therapist, but yeah, but I don't use the term doctor. I know some therapists use it all the time, but my clients call me Kara.
Well, that keeps it simple. Kara rhymes with Sarah, right?
Yep.
Okay. And tell me then, where did you go to work right after you came out of OT school? Because that first job, a lot of people are interested about how you navigated your career.
Yeah. So I did my level 2 field work. So after OT school, we had to do 2 3-month placements. And I did one in Aberdeen, South Dakota, which is close to where I'm from. And then I did my second one in Sioux City, Iowa at St. Luke's Hospital. And then they just hired me right after my internship. So I just started working from there when I was done with my field work.
And now take us from there to here, kind of walk us through your career path.
Well, it's kind of an interesting story. So I worked at St. Luke's in Sioux City, Iowa for a few years. And it was a great position because they have a burn unit there. So I was able to work on the burn unit, acute care, rehab, some peds, a variety of good experiences. But it was about a 45-minute drive from where we were living. And a couple years in, I happened to see a job posting for the director of an early Head Start program. And it was in Vermilion, South Dakota, where we were living. And I'm like, I'm going to apply for that job. And I ended up getting that job. And so it wasn't direct occupational therapy, but it used, tons of our background as occupational therapists. And the cool thing is it was a brand new program that hadn't been started yet. So my job was to help start this program from the ground up, which means like ordering all of the equipment, supplies, hiring all of the staff. And then with the early Head Start, you have to meet all the federal regulations. So getting all of the policies and procedures and regulations in place. And I was there, I think, about 3 years. And while I was there, I kept working PRN just to keep my OT side of things in place. But when I was there, my husband got a job offer up here in Grand Forks, North Dakota. So I ended up leaving that job, which I honestly think I would have stayed there forever because I loved it. It was, it was a lot of fun. And so then when we moved up here to Grand Forks, North Dakota, I originally thought I would stay at home because when we moved here, our middle daughter was only 4 weeks old. And so I was going to try the whole stay-at-home mom thing. Well, that didn't quite fit my personality the best. I like to be out and about and doing things and developing programs and you name it. So I ended up going to work 3 days a week, which was a perfect fit because that way I could be home with my kiddos 2 days. I worked 3 days and they could go to daycare, spend time with friends. So for several years, I worked 3 days a week with the healthcare system up here. And I would go to nursing homes. I started an outpatient clinic in East Grand Forks, Minnesota. And speaking of shoulders, when we started that clinic, that's what my primary responsibility was, to see clients with shoulders. They had sent me to some different trainings and so forth to do that. But I did a lot of work in skilled nursing facilities, transitional care units. And through that time, I was able to help start a variety of kind of outpatient clinics with assisted living facilities, memory care, which were like Medicare Part B, basically in the client's homes, which is really what I'm doing now. And I'm like, I should have started those on my own way back then, but who knows? So I did that for several years. And then in 2012, I ended up teaching full-time in an occupational therapy assistant program. And again, it wasn't anything I had ever really thought of or anticipated, but someone called me up that worked at the college and said that I should apply for this job. It was an academic fieldwork coordinator position and then also a faculty member. So I got that position and then I taught there from 2012 until I think it was like 2018. A lot of stuff. And so then about 2017 or so, I started my own practice working with older adults in the home. So these are kind of the big deal now is therapists going into their own business and doing mobile hybrid practices across the United States. And I had always wanted to start my own business, but hadn't a clue how or what to do with it. And it just so happened that I went in to meet with this couple one day about their programs and what kind of services they had, because I was looking for a fieldwork site for a student. And they were talking about how they were getting home health part A. So for medical people out there, when clients go home and they get home health, they're often on home health part A because they've had a hospital stay and they can't leave their home and so forth. So they were just starting their business doing that. And they were going to need like an OT and a PT and so forth. Mm-hmm. And I was telling them, well, I want to start my own business, but I want to do Medicare Part B, which is outpatient in the home. Long story short, he's like, you should start your own business and contract with me. So I started my own business and I contracted with them to do the home health part A stuff through their business. And then we do the outpatient part B through my business. And since we've started, now we also take other insurances like Blue Cross Blue Shield, Sanford Health, with the VA, a variety. So it's just kind of bloomed over the last few years into a variety of insurances. And we also have some other contracts that we work with other people in the community. And so that started getting busier and busier, and it was just time for me to leave teaching. So I left teaching and now doing my home therapy solutions business. And that's going very well. We have 3 PTs and 3 OTs and an OTA right now that work with us with that. So that's what I was out doing this morning, is seeing our clients.
I know you have more to say about that, but I want to interrupt because you call it a hybrid practice. Now,
Yeah.
Give us a definition of why you call it that.
Perfect. So when I first wanted to start a practice, everything online, like Facebook, and, you know, when you started reading, you saw all these physical therapists starting cash-based practices because, you know, they're tired of dealing with insurance. They want to just deal with cash, not deal with insurance. The client pays them, they treat them, they go home. You don't have to all the paperwork and all the hassle. So I'm like, well, I want to do that. Who doesn't want to do that? So that's what I was going to do when I started. But then once I realized and learned more about the system and Medicare and so forth for my population, I have to bill Medicare Part B. So OTs, PTs, we can't opt out of Medicare where there's a mandatory claim submission process. So we have to, I mean, trust me, there's people that get around it out there, but for me, that's my primary population. And I know around here, they want their insurance billed, you know? So a hybrid practice means a combination of cash pay along with other insurances. So it's not just insurance, it's not just private pay. So it's kind of a hybrid approach. And we do private pay. So we have some people that private pay us. We take insurance, a variety of different insurances. We also do out of network. So if there's an insurance that we don't have, we have billed out of network. And then, like I say, we also contract with other agencies too, where we see their clients and they just reimburse us. So it's kind of a mixed bag approach of how your reimbursement's going to be.
So word must have got out about what you were doing because now you're helping other people develop practices like you. Tell me about that a little bit.
Yeah, so a few years ago, I went to the American Occupational Therapy Association conference, and I believe it was when it was in New Orleans. And so since I was teaching at that time, I always went to the pre-conference workshops and sessions for educators. And at that time, the incoming and the outgoing AOTA president had a presentation on how entrepreneurship is the wave of, of the future for occupational therapists, which I 100% believe in, great, so forth. But what we lack is resources to help us. Because when I started my practice, there was literally nothing to help me. And I made several costly errors and so forth. And I just kind of learned along the ways and stressful and so forth. So I went to that conference, and 2 months later, I went to a business conference. At the conference, the AOTA president, when I got up and asked, I said, okay, so I agree with you guys that this is the way of the future for OTs, but how is AOTA going to help us do that? Because, we have nothing out there for us to show us what to do. And they recommend that we go to a good business conference. So I happened to find a conference it was Smart Success Healthcare with Greg Todd. I don't know if you're familiar with Greg Todd or not, but he's somebody you'll definitely have to connect with. So Greg Todd it was Smart Success Physical Therapist, and now it's Smart Success Healthcare. But he had this live event in May of 2019. And it was amazing. Like I went there and it was like this hype show. Like it was like a conference like no other. Like one presenter passed out champagne to everyone at 10 o'clock in the morning. There's live music, everyone up dancing and so forth. But the thing that really got me is it was just an upbeat community, and they were all supporting each other, and they're all supporting each other to work for themselves. And creative ways on how physical therapists, can start and run their own business and all of these different things out there. And I was like, we need this for occupational therapists. Why, because that was really at that time focused for physical therapists. So I told Greg at that training, I'm like, I want to do this for OTs. We need this for OTs. So at that conference, I actually started the Facebook group, Next Level Occupational Therapy, with the goal of helping occupational therapists get to the next level in their career, whether that be, starting a business or, going up in where they're currently at, doing a side hustle, anything, just kind of moving up the ladder and seeing that there's more out there that we could do. So I started that, and that actually kind of boomed quite quickly. We had a lot of people joining it and so forth. And then come fall of, can't even remember if it was the fall of that year or the year after, therapists started losing their jobs because of changes in healthcare with Medicare in the nursing home and then with home health. And so I contacted a couple of my support team and people that, I work with, Steve Gluck, who's the CEO of Hello Note, Andy Nielsen, he's an OT that also went to school with marketing and so forth. And I'm like, we need to help these people. I'm like, we can show them how to start and build their practice. We have all the tools, the resources and so forth. Why don't we, start a therapy business builder program? So we threw it together and threw it out there because, again, we were seeing therapists posting all the time how they lost their job or they got a pay cut or this, like, in this and that. So we started the therapy business builder program. And since then, it's just continued to boom, and we continue to help more and more therapists across the United States start and build their own business. And when we initially started, we really, we helped any type of therapy business. But my passion has honestly become working with older adults, and there's a huge need for these mobile practices working with older adults in the community. So starting in April, we revised our program and we have different level systems. So people start in level 1, and once they get that finished, then they can move on. And we've found that it really helps people progress through the program so much better. But people that are working with me are only ones that are working with older adults. And another fun thing is that we also help the therapists become an age-friendly healthcare system, which is a big push across the United States with trying to get more hospitals, healthcare centers, clinics to be age-friendly healthcare systems. And if you Google that, you'll learn more about what that is. So that's kind of our focus. We also have a couple therapists in Next Level OT that do cash-based practices and have been super successful over the last few years. And they help therapists if they want to build a practice cash-based or like with pediatrics or things like that. So we still help a wide variety of people, but my personal group, we really focus on the mobile hybrid practice for older adults because a mobile practice is a great way to start because your business expenses are so low because you don't have to deal with overhead of space and, all that kind of stuff. And you drive from house to house. So, yeah, super excited. And it's been fun to watch all these therapists start and build their practices around the country.
How many therapists do you think you've helped get started as private business people?
Well, within all of our programs and all the different resources, way over 100. I've kind of lost track of all of the different therapists because we had a program called a visionary membership group where people could join and get a bunch of resources and kind of do it more on their own. And then we have our program where we actually kind of walk them through the process. So yeah, it's been fun.
Wow. Building entrepreneurs, one practice at a time.
Yep, exactly.
Awesome.
That could be my new slogan. I'm just teasing.
Well, Let's back up a few steps because I have to talk about shoulders a little bit.
Yep. Yep.
So at one point, you're working in an outpatient clinic, and you're the shoulder specialist.
Yep.
And you have this propensity to want to work with older people.
Yep.
And of course, we see in our shoulder pulley business, most of the people are 50 years old and older when they start to have repetitive stress injuries, or falls. Obviously falls start to come in right there. And about half of our patients are post-op that really will take the time to do some home therapy.
Yep.
We know from statistics from the United States CDC, Centers for Disease Control, that there's probably 10 times the number of people who have shoulder pain, but they don't engage until somebody puts a knife in them,
Yep.
which is kind of unfortunate. So tell me about the clients that you see with shoulders. Do we match up there? And
Yeah. So, I mean, again, I've had post-op shoulder replacements, reverse shoulder replacements, rotator cuff injuries, just frozen shoulders, people not moving, just, arthritis, so forth. So we still get a variety of shoulder injuries in the mobile clinic. And yeah, the RangeMaster in all of your different products actually have been, very helpful. And I love the system you guys have that we can just give the client a way that they can just order it on their own. But we definitely utilize the different, depending on the shoulder injury and what we're working on, a wide variety of the tools that you have available, not just the Pulleys anymore, right?
Not the Pulleys anymore, no. In fact, we just introduced a new home finger ladder.
Oh, really? I haven't got that one yet.
It goes over the door and kind of cinches down on the door, but a lot of therapists like the finger ladder exercise, and it's so nicely incremental,
Yep, exactly.
So that's the latest thing. And we've also just introduced a neutral handled shoulder pulley that looks kind of like it could stand up on a table all by itself. So to cause the patient to be more in a neutral position to avoid impingement.
Exactly, which is, what we want. I always want that thumb up movement with it. And that's why I should have brought all of my toys over next to me, but they're across from me. I also like your cane, shoulder wand, and how it positions the hand appropriately and so forth. When I was teaching students, we really talked about the positioning of the hand when you're doing shoulders and when and when not to use the Pulleys, things like that as well. So no, I love that you're revising, updating, or creating those, tools that we need so that it's best for the clients out there. And again, make it easy for clients to order on their own. Because as private practice owners, that's one thing. I mean, I don't carry a huge stock of stuff. So it's nice just to let them order. I mean, and I've ordered and had them reimburse me and stuff. I mean, I've done that before, but it's not like a big hospital where you have things in stock you can just, hand out and bill them later.
Yeah. And the whole process of billing is time consuming and expensive as a result. And so it's nice for them to go on. Our Amazon store has, I think we're about 4x in business over last year, given, well, maybe we're 2x. It just keeps going with the pandemic,
Oh,
people are learning how to order things online, and just fortuitous that we got there before the pandemic did.
Oh, no, that's huge. I mean, that's where all my clients, even though most of them are older than 70, pretty much, a lot of them, that's where they order, anything they need. So It's great.
Well, talk a little bit about you. You did talk about the shoulder pulley as when you find it appropriate and when you find it inappropriate. Tell me about when you find it inappropriate. Give me some feedback there.
Well, especially, depending on post CVA depending on their scapular movement and where they're at with that. And, making sure that's appropriate and they aren't just cranking their arm up there when their scapula is not even moving. I mean, right. I just see it. Some therapists not really thinking about what they're doing with that. I'd say frozen shoulder. I've utilized it quite a bit, Pulleys with like frozen shoulder. If doctors have protocols, our little recipes that we have to follow, utilizing it in that manner as well. Arthritis, sometimes when the clients are able to control their motion versus, someone else cranking on it and they can gradually increase the motion and get that. I think that's nice as well. But no, I'm super excited about the handle because I always try to teach my clients to hold it thumb up. So that'll be a nice tool to use. And I also like, I'm not very good on names, but I'm a huge proponent of like scapular protraction type exercises and so forth. So using that you have, I can't even think, with the band that hooks in the door and pulls it back.
Master PT, we call it.
There you go. See, I'm not very good on names. I just call it the thing over there or show my clients. And yeah, I'd go back to the wand, using that so they control the movement and are getting the right position and so forth versus someone cranking on them. But
I think you really lower the barriers to exercise when you let the patient take control of their pain level.
Mm-hmm.
And they start to realize that they really can move in a pain-free range. We both probably have heard a lot of stories about patients who don't go back to therapy because the therapist felt obligated to hurt them. And with a good intent, but it's all about patient engagement. If they're going to own a little bit of their recovery there, which is fundamental to making a positive recovery, then they got to buy in. I often have to explain the shoulder pulley. There's no magic in the shoulder pulley. The magic is in the movement. The shoulder pulley is a nice reminder of how to move and how often to move.
Right. Well, and like what you said, client or patient buy-in. So I try to be as occupation-based, client-centered, as possible. So, if they're not buying into something or aren't going to use it, I definitely don't push it by that manner either. But, some clients, it really helps, they see that there, they know they can control the movement. They're not as stressed and tense when they're in control versus if a therapist is holding their arm and they're worried they're going to crank it, they kind of tense up a little bit more. So yeah.
I'd like to visit with you just a little bit about your early Head Start work. What an interesting mix of clients, because you're not just working with the child, but you're working with the parent or the caregiver.
Yeah.
And there's an opportunity there first to introduce the child to some fundamental movement that can help with their brain development, and bring the parent along in how important all aspects of early childhood development are into later successful outcomes. Tell me about how you incorporated, because there's a mental health aspect there into OT as well.
Exactly. And that's the one thing with early Head Start, and I've kind of lost track over the years, since I'm not doing it anymore. But what I really loved about it is we started the parents could start in our program before they even had the child. So we had moms that were pregnant, their spouses that could enroll in the program prenatally. to get that education and support they needed even prenatally. And then once the baby's born, then roll them over, and then the child and the parent, get the services together. And when we started, we were all home-based. So we would have family caregivers, I can't remember the exact term, but we would have staff go out to their homes, and they would go over everything from, mental health, nutrition, physical health, development, gross motor, fine motor, cognitive, and just a support system for the parent, and as well as help facilitating the child's development. And then we would have like group socializations, so that the parents and their children in a certain area would all come to a location, and we would have group socialization events where there was time for the kids to interact and play, time for the the parents to interact. They had parent meetings, parent education events. So yeah, it was just a great program, combining, not separating, not just for the kids, but for everyone involved. Siblings could come as well. And it was a good balanced program that really tried to help improve overall development, socially, physically, cognitively. Yeah, and it was also a lot of good resources too, a support system and stuff for the parents that, may not have had access to that before.
Sure, and young parents can use some companionship with other young parents as they go through this how-to stage,
Yeah.
Not always intuitive what the right thing to do is.
Right. And we had a lot of, brand new parents, very young parents, parents maybe with, not the best support system. So to kind of be in this early Head Start family where you're surrounded with a variety of people to help you and your child and children grow, that was awesome. No, I loved it. It was such a great program. And so the university had a Head Start program, which was 3 to 5. And that had been kind of there for a while and was doing really well. And then they got this grant to add the early Head Start portion on. So that's when I came in to get that early Head Start portion on. So it was really fun. It was hard to leave because it was kind of like my baby. I mean, we started it from the bottom up and saw it grow, and yeah, it was a lot of really good.
What a great career path, though. I mean, look at you. You've worked with the very earliest prenatal all the way through young adults, and now people that are non-operative, people that are post-operative, and frankly, you're now working with probably some people that are nearing end of life.
Mm-hmm. Yeah, we do. In fact, I've had a couple people in the last few months that we've transitioned over to hospice care. So the whole lifespan.
Yeah, it sure is. Well, let's conclude. Let's tell people how they can get a hold of you. So when we publish this, you're ready. They've got your information. So through Next Level OT Group, how do they find you?
Yep. So our website is just www.nextlevelot.com. And on the website, there's links to our YouTube channel, which we have lots of webinars. We have a podcast. And the Next Level podcast is we interview occupational therapy entrepreneurs who have started their own business, obviously, if they're entrepreneurs, and they share their story and tips to help other therapy professionals. And then we have lots of free resources just to help people think about getting started in private practice. People can email me. It's just Kara@nextlevelot.com. For people interested in our therapy business builder program, you can email me, message me. We have calls that we set up on a weekly basis for people that are interested in starting their business and want to see if our program's the right fit. Because that's one of the biggest things is we want to make sure that people who start our program are the right fit and are going to finish the program. And that's why we've made we continue to have adapted and adapted and adapted ever since we started our program, because we want to continue to improve it, but we want to make sure that it's the right fit for therapists, because we want their outcome to be starting a private practice and for it to be successful. So we've really kind of honed in on, you have to have this, and this in order to get into the program. And we want to make sure it's the best fit for you. So.
Well, Kara Welke from Next Level OT Group, thanks very much for joining us today.
Thank you. I'm very grateful, and I want to give a shout out to you because RangeMaster has so gratefully provided products for all of our therapists in our Therapy Business Builder program. So everyone in our Therapy Business Builder program has gotten 3 different products from you guys that they've loved and been able to use out in their new practice. And as well as people in our Next Level group, when they join our group, they can sign up and get a product from you guys. And that has been a huge hit, and therapists love it and have really told me how much they appreciate that. So thank you for all of that as well.
You bet. That's an offer we make to all new practices, and people going into homes especially. We'll give them a little tear off order form that they can use to have the patient go directly to Amazon.
Yeah.
Well, thank you very much, and I'm sure we'll have chances to visit again in the future.
Sounds good. Thank you. Have a great day.
All right. Bye-bye.
Bye-bye.